And finding medical care when you're uninsured or cannot afford care can be very difficult, but it does not have to be. Dr. Johnny Cook is here, the director of the Davis Volunteer Medical Clinic, to talk about opportunities and resources available to anyone. We want everyone to get their medical care, whether or not they can pay for it. So let's talk about that. People have a decision to make. They need to go see a doctor, but they might be afraid of how they are going to pay for it.
In the state of Utah, there are roughly 10% of people who don't have health care, don't have insurance, and as a result, several clinics have come forward to help as a labor of love to help those people who don't have insurance.
And so how does yours work? And first I'll tell you where your clinic's located and how it functions.
Sure. The Davis Volunteer Medical Clinic is in Clearfield. The address is 22 South State. It's where the Davis County Health Department is. We've been very grateful to have the Midtown Clinic there as a place. They let us use their services after hours. So Tuesday and Thursday night from 6 to 8 p.m. we see patients who don't have insurance, and we can see them for sicknesses or for chronic health problems or anything that needed to be seen for. We also have the hospitals in Davis County, Davis Hospital, Lakeview, and the new Intermountain Layton Hospital as places where we can send them for free x-rays and blood tests, which has been very helpful.
Because it's a scary situation. You don't feel well, you need some help, but you don't know where to go. So when someone comes to your clinic, or some of them similar, what do they need to be armed with? What information? What do they need to be ready to provide?
Mainly, they just need to know what their health care situation is. The clinic doesn't require evidence that they don't have insurance. They just need to come. The clinic, usually you would want to get there by 5:30 because often the clinics get full, but they just need to come in. It helps if they know their health problems, their medicines, their allergies, so that we can treat them well.
Now, as a longtime member of the medical industry, how important is it for you to be part of something to help serve those who really need the help?
It's been a joy. It's been a lot of fun to be able to help people who are disadvantaged, and it's a labor of love. It's a chance to give back. I've been very blessed in my life, and this is a chance to give back to those in need.
I love that. Now, for people who might not live in Davis County, there are other opportunities for similar clinics throughout the state, correct?
Yes. If my math is right, there's roughly 9 clinics. There's several in Salt Lake, 4th Street Clinic, Malihe. There's clinics in Moab and St. George. And our Davis Volunteer Medical Clinic actually was patterned after the one up at the Ogden Rescue Mission, which is now called the Seeger Clinic. Dr. Floyd Seeger started that clinic in 1988, and when our clinic started, it was a vision of the United Way, who had done a needs resource analysis and found that we needed something similar in Davis County.
Beautiful. Thank you so much for joining us today.